Who told you that when you grow old, your sexual life should also go down? Your sexual life should grow old and grow still. Come on, there are a lot of men, there are a lot of women who are growing old, but they don't want their sexual or sexual desire to go down because they enjoy having sex with their partner and they enjoy having this bond and connection with their partner as they grow old. So growing old does not mean that you should have no sex life. So that is why I am here for you today, especially for the people that are clocking their menopause, andropause, premenopause, pre-andropause phase. Everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 8 tips to have a good sex life after the age of 50. 8 tips to have a good sex life after the age of 50. I actually got this points from Dr. Malik, who is a urologist and also a pelvic surgeon. Yeah, that's who she is. Yeah, and that was where I got the points and I decided to share it with my audience. The first point she shared was take your time. Yes, take your time. Do not rush it. As the woman bodies grow old, as you grow old, there is a decrease in your hormones. Your estrogen levels are going down. Your sex drive is going down. There's vaginal dryness down there. You're experiencing this wetness. It takes time for your body to catch up with what your brain really wants. So during this period, it needs a lot of time. You have to do more of foreplay. Like when you were young, seeing your partner from a distance, you just get excited and might easily get in the mood. But when you grow old, it's your partner might be very, very close, but yet down there is still tried. But what I have to share with this point is that take time. Take your time. Do not rush the encounter. Involve in a lot of foreplay. Involve in a lot of other activities that will help stimulate the body to get in the mood. So don't expect that, oh, after 5 minutes, after 10 minutes, I am having sex. Those like when you were a bit younger. But after age 50, when the menopause stage are setting, there's decrease in estrogen, that might be difficult to bounce back. So that is the first point. Then the second point is try morning sex. So if you are advancing towards age 50, it is advisable you have sex basically in the morning. I'm going to tell you, there's this particular sex hormone which is known as testosterone. This hormone in the morning, the testosterone level is usually high, but as the days goes by, 2 p.m., 3 p.m., the testosterone level decreases. And when you sleep, it decreases. Then when you wake up the next morning, it is back to its high phase. So it is noticed that with this circadian rhythm, that testosterone level, it's usually high in the morning and low in the night. So when the testosterone is high, definitely that sexual urge and drive will also be high. So it's advisable you make time to have sex in the morning when both parties are having high testosterone level and the urge is a little bit high compared to the late night when it's not high. And during this late night, you might be tired, stressed out as a result of work, and anything that should be in your mind then is to get some good rest. And that takes me to the third point, which is experiment. Practical experiment. Experiment a lot of things that can help with it, because as you get old, there are a lot of nerves around there, the clitoris, the vagina, even for the men, the nerves around their penis and all that, they become numb over time. They are no longer active. If you've watched my video about the clitoris, you know that the clitoris has a lot of nerves down there. But as you age, as you advance, these nerves, they become numb and they require some other kind of stimulation to get them activated. So you can try some light sensation using feathers. So people use feathers to like increase their sexual, that to put them in the mood, touching in the ears, kisses in the ears, in some other areas outside your normal clitoral and vaginal stimulation. So you can experiment other things that can make your spouse in the mood and also increase the sexual drive. If possible, getting a gift, just experiment something new. Then another point is the fourth point, which is review the medical history. Yes, review the medical history. Like as one ages, some people are on some antihypertensive medications, there are some other kind of medications, and these medications are likely going to, some medications, not all, are likely going to have effects when it comes to sexual drive, vaginal dryness, and things like that. So it's advisable for you at an old age to know the side effects of this medication. You should not be shy to ask your doctors, to ask your sex therapist, to ask your practitioners if these medications are going to affect your sex drive. Then if it's going to affect, if they can have alternative, good and fine, then that's going to help you boost it. But if they don't have alternative, you just have to look for a way to deal with it. So that takes me to the other point, which is the use of lubricants. I always advise women in their menopausal, premenopausal, and postmenopausal phase to make use of lubricants, because lubricants will help to prevent that vaginal dryness, that pain, that irritation that makes sex annoying, to make it more easy for penetration to take place. So if you are in your menopausal or during that phase you're experiencing dryness, you can try some lubricants. You can try some estrogen replacement therapy. There are some estrogens that can be gotten as pastries, they can be gotten as cream that you can use down there. The pastries are inserted into the vaginal. The creams can be used to rub around the vaginal and things like that. And when that happens, it's going to help boost the whole mood and excitement. So don't be shy to ask for this. Don't be shy to go for things that will help you boost your sex life as a woman, if you like it and your spouse like it. Always talk to your partner, talk to your spouse about the use of all these things. You both should come to a conclusion on how to go about it. Then the other point, which is the sixth point, is use of sex aids. Yes, I don't know if you've heard about sex aids, especially for those that are experiencing pain, they're experiencing back pain, some are experiencing stroke. They will need what is called sex aids. Sex aids helps to put you in a better position for sexual intercourse. For example, there are sex pillows that helps you position your hips. I'm going to be dropping some pictures on the screen that's going to help you know what sex aids are. So that can actually go a long way to help you with positioning during sexual intercourse. So that takes me to the seventh point I have, which is be optimistic. Don't just have this mindset to like, I'm getting to menopause, everything is going to go dry. Just be optimistic with it and say, okay, I am getting to menopause, but I have to enjoy that bond I experience with my spouse. I have to enjoy that bond I experience with my husband. I don't have to just go dry. Just be optimistic about the whole process. Remove every pessimistic thought, every negative thought in regards to sex. Even if you are not in your menopause or menopause, like having the mindset that you want to enjoy sex is going to make it more fun. Having the mindset that you want to enjoy the flow, it's going to make it more fun. So I advise you stay optimistic. Last one I have to share with you is focus on the pleasure more than the performance. Focus on the pleasure more than the performance. Let me tell you something. There are other ways in you we can have pleasure from encountering your spouse. It might not really be an intercourse. It might not be you going in. It might just be some bodily movements, some engagements, some foreplay, things like that creates bonding, that like make everything fun. I don't know how to explain it, but don't feel that sex that can create bonding at old age is going to be through intercourse. There are other ways in which you can have that pleasure, but not still like think about how long you're going to last or things like that. You might have erectile problem as a man, but you can still enjoy the pleasure that comes around with sex. I think you have to think about that and apply that, especially for the men. So this is the point I learned from Dr. Malik, and I decided to share it with you all. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mary saying thank you. Bye, and see you in our next video.